Dr. Constant, the COVID isolation and lockdown delayed autism diagnosis. What are the signs parents should look out for? And what are the therapies that are out there available?
Well, that's a great question. One of a few of the signs that you should look for when screening for autism is number one, a deficit in socialization. And what that means is not really looking at you in the eye, or if a family member or friend walks into the home or walks into a room and your child doesn't turn around and acknowledge their presence, that's usually a red flag for a deficit in socialization, as well as communication, meaning showing you something just by merely pointing. We're not necessarily looking for words per se, but just some form of communication, whether it's by cues or by words. And once those things are picked up and you are able to get a diagnosis of autism, it is really great to get all of the therapy that's available within the community, meaning physical therapy, occupational therapy, speech therapy, and most importantly, applied behavioral analysis, which is a therapy that helps integrate the child into social interactions and helps them communicate in a social setting.
Dr. Constant, let's talk about nutrition in children. And let's talk about eating habits. In terms of like infants, what is the best way to get children to start eating solid foods?
Well, we usually introduce solid foods, meaning anything that is not milk, between ages of 4 and 6 months, and that's in the puree form. And then after 6 months is when we slowly start to introduce other types of solids and increase the consistency. It's important to transition from puree to an increased consistency until fully solid by 12 months of age, because if you delay that transition, a lot of times children will develop what's called an oral aversion, meaning they have an aversion to certain textures. They're not used to those textures in their mouth, and they don't want to try new things because it bothers them, or they're afraid, or they're just not used to using their gag reflex. So it is very important to transition children from puree to solid foods by 12 months of age.
And so there is a couple of school of thoughts, if you will, about
Mhm.
how to get kids or infants, babies used to eating solid foods. There's one where, the traditional one, which I exercised when I had my three children, which is you feed the child with a spoon, right? And sometimes they
Right.
don't accept it, they reject it, but you try again until they get used to it. So it's almost like developing a habit. And then there's that other school of thought of you give the child as young as he may be the spoon, or you let him play with the food, use his fingers to kind of get familiarized with the texture, with the taste, and you kind of let him go or her at her or his own pace. How does that work out? And can you shed light on that?
Sure, those are two different theories, and honestly, you can't go wrong with either one. In my office, I usually encourage parents to do what works best for them and their family. And I think once it's comfortable for you and your family and it works, then you'll be fine. But you can't go wrong with either way, and it just depends on how your child really identifies with food. Some children, even in infancy, just don't like to be messy. They don't like to grab food and play with it, and others don't mind at all. So it really is just up to you, but you can't go wrong either way. And as long as you're introducing foods and you're allowing them to explore, I think that then you're always going to be on the right track.
What are the most common eating disorders in children?
Well, eating disorders per se are not common in children. What I will say is that we see a lot of disordered eating. And what that means is there's a lot of picky eating. Like I mentioned before, oral aversion, meaning just an adversity to certain textures. There are behavioral issues around eating just because eating has changed in our society. We rarely sit down together to eat for every single meal. We rarely have like a designated time to eat, where nowadays even young toddlers eat on the go, eat in their stroller, or maybe in the car. And so there are some disordered patterns that are usually associated with eating, but not necessarily an eating disorder per se, which we usually would see maybe in older childhood or adolescence.
So, what do you recommend? It sounds like for creating those healthy eating habits, it sounds like having an organized meal plan or certain times of the day that you can create consistency or good habits. What would you advise?
Well, I would advise absolutely that is setting designated eating times. Oftentimes eating ends up being on this spectrum of time where you start in the house and you keep on eating as you're walking out the door and in the car. And I think that it's important to have a designated time where you start and you finish. And even if you don't finish your food, that's fine, but the eating time should end. And I also think it's important to remove stress around eating. I think oftentimes we're very preoccupied with making sure our children eat the quote unquote right foods or get all of the right groups. While that's ideal, we just can't have it that way all the time. So as parents, we need to learn to relax a little bit when it comes to mealtime and just allow our children to enjoy what they're eating and enjoy the time that they have with us, that they're sharing with us, and not focus so much on how much they're eating and if they're eating the things that we feel are important at that time.
I want to go back to the infants. By what month should they be having breakfast, lunch, and dinner? In addition to, of course, the milk feedings.
Right. So usually when you start, and depending if you start introducing solids at 4 months versus 6 months, you would start with 1 meal a day. And then you kind of just go by what your infant is doing. Sometimes they're enthusiastic eaters and they're ready to go up to 2 or even 3 meals a day. And some are a little bit slower and it takes them longer to get there. But ultimately, I would say between 9 and 12 months, you should be able to give your child 3 meals a day.
And what can parents do to deal with a picky eater at home?
A picky eater at home is a very difficult situation for everyone. And I think that all of us have had at least one child who's a picky eater. And the advice that I give is very simply, number one, try to hide the foods, cut them up, mix them into something else so that your child doesn't see it or taste it. You can find 2 or 3 things that your child may like and stick to it. There's nothing wrong with them eating the same thing for a few days or even months at a time. Over time, as maturity comes, their palate will change and you will be able to introduce other foods. And lastly, most importantly, is just don't be so hard on them. Don't make food a battleground and don't put so much importance on eating something because that's just going to push your child further away from trying something new.
According to Stanford Medicine, lack of exercise and not as much diet as diet is linked to rising obesity population. So what are the physical complications of childhood obesity and its long-term effects?
Well, the complications are usually getting body aches like knee pain, a lot of back pain, low they're cardiovascularly, these children don't have as much endurance as they should for their age. They tend to suffer from injuries at a lot higher rates than their counterparts because they're not stretching and they're not physically active. And of course, most importantly, is we're seeing higher levels of cholesterol, bad cholesterol, and triglycerides in children that have very sedentary lifestyles. So with an alteration in your lipid profile, which is your cholesterol and your triglyceride, you're running a higher risk of heart disease at a much earlier age than you should.
Inactivity is often caused by increased screen time. So how much screen time is too much screen time for kids? Can you share some tips on how parents can avoid tech tantrums?
Right. The screen time question is very interesting because the American Academy of Pediatrics has always recommended no more than 2 hours of screen time a day. But now things have changed so much, especially with the pandemic. I mean, our children now actually complete their classwork on the computer. So it's almost impossible to limit it in that way. I would say that, instead of limiting the time overall, just try to engage your child in other activities that outside of watching TV or playing video games. If you're spending half the day on the laptop or on the computer doing schoolwork, then most likely you don't want to spend another 2 hours just, watching television or playing video games. So I think it's important to set limits there. And as far as the tech tantrums, that is such a big problem. And I feel that it starts so early on. And I think the best thing to do is as soon as your child is able to understand and communicate with you, you should set parameters for screen time. If they want to watch a show or watch a movie or look at their phone or play video games, I think before it even starts, you set up a reasonable timeline and let them know that it will end at a certain time. That way they're not so surprised when you decide to cut it off. That would decrease the intensity of the tantrums, or hopefully the incidence of tantrums.
What are the 5 most common childhood illnesses?
I would say, at least school age children, it would be bronchiolitis, which is a respiratory infection that causes wheezing and coughing, gastroenteritis, which is vomiting and diarrhea, otitis media, which is our ear infections effectively, pharyngitis, which is a throat infection, whether it's viral or bacterial, like strep throat, and let's see, probably pink eye conjunctivitis. I would say in school-age children, those are the most common.
And with these common illnesses, what is the best approach in treating them? Should you take your child to the doctor right away? Are there over-the-counter medicines? When is the right time to, dig deeper?
Right. Well, with a lot of the viral illnesses, I'm sure sometimes patients are frustrated when we say, "Oh, don't worry, it'll go away on its own," and it is really hard to hear sometimes, but it's true. A lot of viruses will resolve on their own. I think you should be concerned when, after 3 or 4 days, either A, your child is not getting better, or B, at any point your child is worsening, you should bring them in to see their pediatrician. If there's a fever or other signs that are just not getting better, you should always have them seen by their pediatrician. I would also say that there's no need to go to an urgent care right away on the first sign of at the first sight of a symptom of illness. You should usually just wait to see your pediatrician in the morning, and they can address it or guide you or even reassure you that the illness will get better on its own, or perhaps your child might need antibiotics.
Constipation is a common problem in children, even infants. How can parents treat this problem and help prevent it from happening repeatedly?
Right. Constipation is actually a very complicated illness. And the short answer to that is a lot of the times it is truly behavioral. And aside from having a good regular diet, it's very important as parents that we monitor our children's bowel habits. We encourage them to try to go every day. A lot of kids don't, or a lot of children or even parents don't know that it's normal to go every single day. And we have to check up on our children and ask them, have you gone, or have you tried to go? Because a lot of times they spend their day at school and they don't have a chance to go for various reasons. And by the time they come home, the urge is gone. And before you know it, they've skipped 2, 3, or even 4 days of having a bowel movement. So it is important to speak to our children, have open communication, encourage them to frequently go to the bathroom and try and monitor their habits.
In terms of habits, does water play an important role in avoiding constipation? What are some of the tips that parents can use to make sure that their child, doesn't have problems with constipation or to avoid constipation?
Right, absolutely. Hydrating is absolutely very important, and it oftentimes it's very hard to hydrate again in school-age children because they're in class all day. So you really want to encourage water drinking. You want to encourage, of course, vegetables are very important, but fruits are also important as well, as they have natural sugars, which help with moving your bowels. So I would say sugars, vegetables, increasing your water intake, and just making sure that every day you try to take care of yourself and use the bathroom.
What about a sedentary lifestyle? Does that contribute to constipation? Is activity helpful to avoid constipation?
Of course, activity is important for many reasons, of course. But yes, moving your bowels, if you are exercising and very active, you do have a much healthier bowel motility. And also, I should add that probiotics have proven to be very helpful in preventing constipation and even helping with gut motility.
When children get sick, they're often prescribed antibiotics. What are the pros and cons of taking antibiotics?
Well, when you have a bacterial infection, antibiotics are absolutely indicated. The only way to get rid of a bacteria is to treat it with antibiotics. So that is obviously one of the biggest pros. Yes, treating frequently with antibiotics can eventually cause resistance, which means that you could develop bacterial infections that are resistant to the first line of antibiotics that we would typically use. So we absolutely do not want to overuse antibiotics for that reason. And also, overuse in antibiotics is harmful to our gut because it, as we've learned, it kills the good bacteria that we have in the gut, which is the reason why we encourage probiotics to restore it. So overuse of antibiotics, of course, is not ideal. It can increase resistance to bacterial infections, and it can disrupt gut health. But it is actually very important in order to prevent a serious infection from spreading throughout the body.
Could you discuss common household products that can harm a baby that we should keep away from the baby's room, and just make sure that, it's not in the environment, and obviously that the baby doesn't come in contact with them?
Right. Well, we've leaned away from baby powder a long time ago, and that's because baby powder is an inhalant, and they can inhale it, and it irritates the lungs a little bit. It's not toxic and it's not poisonous, but we have found that it is a lung irritant. So we've stayed away from powders, all types of powders. Products that have a very noxious odor. So anything like ammonia or any cleaning products that are very strong that can be inhaled are also harmful to the baby. Other than that, organic products are great, and it's wonderful to have in the house so that you don't have chemicals that the baby's coming into contact with, but it's not absolutely necessary. If you cannot get your hands on absolutely organic products, then that's okay, as long as you're staying away from those that are very strong and have inhalant properties.
Can you shed some light on some of the activities or things that parents can do with the child or for the child that can help in the cognitive development? I'm thinking maybe singing, reading, just anything that gets that stimulates the baby's brain.
Right. Absolutely. Reading is most important as early as the newborn phase. If you could read to your baby, there's nothing better than that. Just hearing the language and the articulation, and of course, bonding with your parent. Music is also very beneficial. And then as they get a little bit older, stacking blocks, putting big puzzles together, matching animals with animal sound, anything that really gets their brain working and actually their synapses firing so that they can actually problem solve and fit shapes and feel things. That's always great for development. And also, it's really important not to overstimulate your baby. Oftentimes, we get very excited about educational activities and toys and puzzles, and we put it all there in front of our child to play with. But it is really important to limit the amount of things you expose them to. So what I mean by that is, in a playpen, maybe put 2 or 3 toys at a time that they can play with and learn and master. And then over another month or 2, you can rotate those toys out and put another 2 or 3, rather than putting all 10 or 12 in at the same time and letting them just kind of play with everything all at once. Usually that's a very good approach.
What is the notion now about walkers?
Right. Yes. Walkers are discouraged for those 2 reasons. Number one, there was an increased incidence in tibial fractures, which is a fracture in the leg where the children were running around the house and then the walkers would kind of tip over and they'd break their leg. So that was like a hazard. But also the way you place a child into a walker, they kind of externally rotate their hips. So prolonged time in the walker can eventually lead to hip dislocation or delayed walking. So it has been discouraged. Instead, now they have the exercisers that the children can sit in and bounce in, and they have the walker that you actually hold on to and push, and you will walk with it, which is really great. Even with the exercisers, I always advise my patients not to leave their children in for more than 15 or 20 minutes at a time, because again, that does start to rotate their hip out.
Anything that you feel is important for parents to know?
Sure. I think that, it's wonderful that we've all been so proactive in interacting with our children and trying to stimulate them and introduce cognitive games with them and toys. And I think that's wonderful. But I also think the most important thing for us to all remember is that interacting with our children and connecting with our children at home is very important. And while we're reading to them, let's try to also just share some time together it's not focused on necessarily teaching something, but just being together and sharing our day and talking to each other. Even with our infants, just letting our infant listen to us speak to one another as adults, that's all part of a wonderful learning experience.